Hello, I'm Emma Anderson and I led the PIP study where we interviewed pregnant women about social distancing in the first UK lockdown within the pandemic. Now the rules at the time were you were allowed out for exercise once a day or for essential shopping or healthcare, but to stay at home as much as possible. Pregnant women were categorised as at risk, requiring extra vigilance with following the guidance. So we interviewed 31 pregnant women. And what we found was there was some confusion about what that at-risk category meant. Women wanted to know why they were vulnerable and what was expected of them. Some thought it meant they had to shield completely and stay at home all the time. Women described several challenges of following the guidance. So food shopping, preparing for the baby was really difficult. The loss of social contact was really challenging for women. They saw pregnancy as a time where they most wanted to connect and have the support of friends and family, and to have that taken away really impacted them. Some women talked about the challenges of work. If they weren't able to work from home or furloughed, they didn't know how to keep themselves safe because the guidance wasn't clear. And aspects of the home environment made it quite difficult for some women if they didn't have access to open green space, for example. So despite these challenges, the women we spoke to were highly motivated to adhere to the guidance to keep themselves and their baby safe, and in fact were massively restricting their lives, even more so than the guidance suggested. So several were not leaving the house at all, or hardly going out. Many were washing their shopping before it came in. Some talked about limiting their healthcare appointments. And there was this constant weighing up of relative risks. Is it worth going out for exercise or staying home to be safe? Is it worth seeing the midwife or staying home to be safe? And fear was driving this decision every day. A key theme that came out across all the interviews was this negative impact on women's mental health. And another key concern was a loss of maternity care. So women talked about having their antenatal classes suddenly scrapped. They weren't sure what was happening with their midwife appointments. They'd suffered communication issues, cancelled appointments, though they recognised midwives were doing their best in a challenging situation. So we took the key concerns and questions that were coming out of the interviews, and we produced an infographic to provide some answers and link women up to online sources of information that were reliable and regularly updated. And it was designed to support conversations with midwives. So we shared this online on our website and via social media, and print and poster versions with our local maternity teams. So overall, it seems that the at-risk category was confusing for women, and we were quite concerned about the negative mental health impacts and the loss of maternity care that the social distancing guidance brought. And it suggests that there's a growing area of unmet health needs in pregnant women and new mothers that was going to need to be addressed. So obviously that's a brief summary of our research. Please read our paper for more details, and there's a link to that from our website where you can also access the infographic. Thank you.